Hi, very good evening. So this is our 12th live session, right? So this live session we're planning it different from now on. Every Wednesday we're planning it differently. In the sense we'll be having a textbook discussion, right? So as I mentioned prior, I'll be sharing you a topic and also the standard textbook reference. So it's better if you have a hard copy along with you and also notes, right? So notes along with so that you can note down important points as and when discussed, right? So that's how we're going to plan. So I'll start a live session, I'll start discussion in few minutes. So before that I have few things to adjust here, right? Yeah, 1 second. I think we can go ahead. Yeah, a very good evening all of you. Shreya, Anupama, Pooja, Jagadish, hi. A very good evening. Hope I'm audible, right? I think is it fine if I talk in this voice level, or do you think I should raise my voice level? If it's fine, just give me a thumbs up sign, right? Yeah. Good evening, Aishwarya. So in this live session we'll be discussing basic principles of Clasp design, right? So Clasp assembly, Clasp design. So the basic principles of Clasp design and reference, it's McCracken. I think I got 11th edition, right? So we even have 12th edition available, a soft copy. One of our friends shared it online. So McCracken's 11th edition, and also I said page number 89, right? So the topic for discussion is basic principles of Clasp design. So before going into the topic, right, so I just found few key terms or terminologies in the beginning of this textbook of McCracken, right, where they have discussed very well regarding all the terms which we come across in an RPD, right? So I'll try to make sure that we discuss all these terminologies in a separate live session, but in this live session we'll just discuss few related terms pertaining to principles of basic Clasp design, right? So I'll just go through the few terms, and then we'll proceed with the topic, with the core topic which we're going to discuss today, right? Yeah, if in case you have a hard copy of McCracken, you can open page number 8, page number 7 and 8, where they have discussed the terminologies, right? So I'll just briefly discuss about guiding planes, Clasp assembly, right? So that, when discussing the basic designs of Clasp, then we'll be coming across these terms, right? So I'll just start with guiding planes. So what are guiding planes? So two or more, say if you have a hard copy, better you keep a marker along with you, and also notes and a pen, right? So that you can even note down, if at all we come across any important topics or points, then you can just note them down, right? So we'll just go ahead into the topic. So first we'll discuss what guiding planes are, right? So guiding planes are nothing but a parallel lines or parallel walls, two or more vertically parallel surfaces of abutment teeth. I guess you all know what is abutment teeth, right? So alongside edentulous areas we have this supporting teeth or abutment teeth. So two or more vertically parallel surfaces of abutment teeth shaped to direct a processes during placement and removal, they are called as guiding planes. So as the name itself indicates, guiding planes are those planes which guide the processes for either placing it or for either removing it, right? So two or more vertically parallel surfaces of abutment teeth which are shaped to direct a processes during placement, number one, and also during removal, right? So that's very important. So that's regarding guiding planes, right? And then if you look at the next term, that is a retainer. So what is a retainer basically? A retainer is defined as any type of clasp, attachment, device, etc., which is used for fixation, stabilization, or retention of a process. So as the name itself indicates, right? So we'll start with the basic things. Whenever you come across any term, first try to understand its literal meaning, right? The English literature, the literal meaning, so that you'll have an idea of what you're actually reading or trying to understand. So retainer is something which retains, right? So it's a type of either clasp or attachment or a device. For example, we have this precision attachments, etc., right, which are used for fixation, stabilization, or retention of a processes, right? So that's the purpose, very purpose of retainer, right? So they mainly help in fixation, stabilization, as well as retention. So in these retainers, we have direct retainers as well as indirect retainers, as you all know, right? So what's a direct retainer? A direct retainer, I mean, if you're having a hard copy, it's page number 8 in McCracken's 11th edition, right? Okay. A direct retainer is that component of an RPD used to retain or prevent dislodgement. So a component of RPD which helps in retaining or prevents dislodgement, right? So that is a direct retainer. And this direct retainer consists of a clasp assembly or a precision attachment, right? Now let's see what is a clasp assembly. So clasp assembly, as you know, it has a rest, and then it has a direct retainer, indirect retainer. So we have all these components, right? So a clasp assembly is a part of a removable partial denture that acts as a direct retainer and or stabilizer for a processes by partially encompassing or contacting an abutment. So on the abutment teeth, by engaging the undercuts which are present below the height of contour, we have something called as height of contour in every tooth. So height of contour is nothing but at a given surface. For example, as you can see my hand, right? So consider this as a surface, right? So in this given surface, the height of contour would be obviously the highest point. So this highest point is considered as summit, and the line joining this summit is called as height of contour, right? So assume that I have placed this hand in this way. So this is the occlusal side, gingival side, and if this is the height of contour, obviously this has to be the undercut area, right? So this is the undercut area we're talking about, right? So we need to understand this because these direct retainers, they work on the basis of engaging these undercuts. Once this undercut is engaged, right, so there will be proper stabilization of the process, and also there will be retention of the processes, right? So that's very important. So it's very simple to understand. If you look at the diagram, it will be much more easier, right? Now in this clasp assembly, we're calling it as assembly because it contains few components, right? The first one is clasp. So what is a clasp? A clasp or a direct retainer is the component of clasp assembly that engages a portion of a tooth surface and either enters an undercut for retention or remains entirely above the height of contour to act as a reciprocating element. So as I said, if this is the height of contour, in order to retain the processes, the clasp has to engage the undercut, or if it tries to stabilize the processes, it has to be present over the height of contour to help in stabilization, right? So that's what they have been explaining regarding a clasp. So clasp is nothing but direct retainer that either involves the undercut area or it remains entirely above the height of contour. I hope it's clear now what a height of contour is, right? Yeah, thereby helping in retention or helps in stabilization. Okay, so that's pertaining to clasp. The basic definitions, the basic meanings, right? We're not concerned about definitions, we're trying to understand the concept, the basic meaning of these terms. And then you have this bar clasp, circumferential clasp. We'll not just go into the details of all this, right? So bar clasp, as you all know, it starts from the denture base, flows over the tissue, and then engages the gingival third of an abutment tooth. And circumferential clasp is something which, I mean, based on the circumferential principle, it engages the tooth and helps in retention as well as stabilization, right? We'll not go into the details of this. I mean, we'll discuss these terminologies in a detailed manner in one separate live session, as I said before, right? And then we have this internal attachment, precision attachment, right? So we'll just skip all this because we still have a lot to discuss, right? Yeah. Then we discussed about direct retainer, right? And also we have another term called as indirect retainer. So indirect retainer is something that denotes a part of a removable partial denture that assists the direct retainers in preventing displacement of distal extension denture bases by resisting lever action from the opposite side of the fulcrum. So here we need to understand the principle of levers and fulcrums. We have basically three principles that are very interesting. I mean, it's very easy to understand provided we have proper examples or illustrations, right? We'll definitely make a separate video on this, right? So I mean, we'll just try to restrict to the meaning of this particular line. So indirect retainer is something which denotes a part of an RPD that assists the direct retainers. So it helps the direct retainers in preventing the displacement of distal extension denture bases by resisting lever action from the opposite side of the fulcrum. For example, see, like for example, we have this seesaw, right? Or just assume that, okay, like how can you say, right? So assume this as a hinge joint, a kind of joint. We have a surface, right? So if I'm trying to rotate this plane, consider this as a plane. If I'm trying to rotate this plane, right? So this is being rotated because the forces in this area are acting in this direction, right? So when you're trying to rotate this, right? So in order to prevent this displacement, we need another device or a third component which should be placed here in this area, right? So that this movement, this upward movement of this plane can be prevented, right? So that's a basic function of this indirect retainer. So it's present, it resists the lever action from the opposite side of the fulcrums. Here the fulcrum is this area. So this area forms the fulcrum, right? So around which there is movement, right? So on the opposite side of the fulcrum, so if this plane is moving in this direction, then in the fulcrum on the opposite side we need a third component to stabilize this plane, right? Hope it's clear, right? We'll just come up with a detailed explanation pertaining to that in a separate video, right? So the term indirect retainer denotes a part of an RPD that assists the direct retainers in preventing displacement of distal extension denture bases by resisting lever action from the opposite side of the fulcrum line, right? So that's pertaining to indirect retainer. We'll just stop it here, right? So we've discussed few important key terms pertaining to the topic for discussion today, and now we'll proceed directly into the basic principles of clasp design, right? So it's page 89, 11th edition of McCracken, as I said. Yeah, so before going, we'll just see a few comments here, right? A very good evening once again, all of you. Hi. Right, I hope I'm audible, right? Yeah. Okay. Ajaj says, sir, when we say above height of contour, will it have different meaning for upper? Yes, very good question, Ajaj. I mean, during communication, we have this confusion always, right? Just remember, if you say above or below, it is relative, because for upper teeth, when you say above, it will be automatically or obviously towards the gingival side, right? But for lower teeth, when you say above, it would be obviously on the occlusal side, right? So to avoid this confusion, you can say occlusal to height of contour or gingival to height of contour. You use these terms, then there will be no such confusion, right? So we often face this during communication with our postgraduates or even with our interns or students, right? So you can use the terms gingival to height of contour or occlusal to height of contour rather than saying above the height of contour. If you say above, as I said, there can be a confusion, right, for the upper teeth as well as for lower teeth, right? Yeah, Shreya, you're right. So that's my point, right? Yeah, thumbs up. Now, so coming to the basic principles of clasp design, right? Yeah, Ankur, very good evening. Yeah, I hope you have a hard copy of it, right? Because simultaneously you can even peep into the pictures when we are discussing, and it will be very much clear for all of you, right? So basic principles of clasp design. The clasp assembly, so as we have discussed, the clasp assembly serves a similar function for a removable partial denture that a retainer crown serves for an FPD. So you have this FPD, you have this retainers, abutments, pontics, right? So these clasp assemblies, they're analogs for your retainers present in FPD. So the function of retainer is to retain a processes in case of FPD. So similarly, we have this clasp assembly whose function is mainly to retain the processes, right? So before that we have, I just wanted to discuss these three key important terms. I'll just briefly discuss these terms and then we'll move ahead with the discussion, right? So the terms which I wanted to discuss is support, stability, and retention. We need to have clarity over the differences between these terms, right? Support is nothing but, it's defined as a foundation on which a dental prosthesis rests. or tissue serves as a foundation. So support is nothing but the foundation area or the area on which the processes lies, right? So that is support. And stability is defined as a quality of a processes to be firm, stable, or constant, and to resist displacement by functional, horizontal, and rotational stresses. So functional stresses in different directions, rotational or even rotational stresses. Resistance to these kind of stresses is called as stability, right? Whereas retention is something which is against the vertical forces like a gravity, or when you're eating something sticky, right? You have these vertical forces acting away from the long axis of tooth, right? So resistance to such forces is called as retention. Retention is spoken of as that quality inherent in the denture that resists the vertical forces of dislodgement. The vertical forces of dislodgement, examples: force of gravity, adhesiveness of foods, forces associated with opening of jaws, right? So these are the key terms which are very important. These are like relevant for RPD, even for a complete denture, right? Support, stability, and retention, right? So I'll just stop it there. We'll proceed with the basic principles, right? Just display the image once in front of camera, sir, if possible. Yeah, okay, Shreyash, we'll do it. We'll do it, right? Yeah. So I'll just go ahead without any interruptions, right? The clasp assembly, basic principles of clasp design. The clasp assembly serves a similar function, similar to that of retainers, which we see in case of a fixed partial denture. Both must encircle the prepared tooth in a manner that prevents movement of tooth separate from the retainer. So the function of retainer is to retain the processes to the tooth, and it should not allow the tooth to move away from the retainer, or in other words, a retainer should cling on to the, it should cling on to the abutment tooth, right? So that in that way we have stability as well as retention, right? Here we are using the term freedom of displacement, right? I'll just read out that sentence for you. Freedom of displacement refers to effect of one cylindrical surface on another cylindrical surface. So here he is trying to compare the clasp assembly as one cylinder, right? You have this cylinder, and the tooth as another cylinder. So one cylinder, we have another cylinder on top of the basic cylinder, right? So we have two cylinders here. So that's, they're calling it as freedom of displacement, which refers to the effect of one cylindrical surface encircling the another cylindrical surface, right? So this is the clasp assembly, and this is the tooth, right? So this, they're calling it as freedom of displacement. It implies that the curve that defines the framework is properly shaped if it prevents movement at right angles of tooth. This basic principle of clasp design, I'll just give you the meaning. This basic principle of clasp design offers a two-way benefit. The thing which we discussed, right? This kind of encirclement, right? So this provides a two-way benefit. First, it ensures stability of the tooth position because of the restraint from the encirclement. And second, it ensures stability of the clasp assembly because of controlled position of clasp in 3 dimensions. Since we have this, we are designing a clasp assembly over a tooth. So the tooth remains stable in position. Any abnormal forces being transferred from the processes onto the tooth can be minimized because of this restrainment of movements in tooth because of presence of this kind of clasp assembly, which is trying to encircle and stabilize the tooth. And also we're calling it as two-way benefit because even the clasp assembly is being stabilized, it's being get locked in 3-dimensional manner on a tooth, right? So it's like win-win situation, right? The tooth remains stable, even the clasp assembly remains stable in a controlled position 3-dimensionally, right? So the principle which we are using here is this principle. What do you call this principle? This principle is called as principle of encirclement, right? Encirclement. So therefore the basic principle of clasp design, referred to as principle of encirclement, means that more than 180 degrees in the greatest circumference of the tooth, passing from diverging axial surfaces to converging axial surfaces, must be engaged by the clasp assembly. For example, consider this as tooth. Consider this knuckle as 0 degrees. This is 90 degrees. This is 180 degrees, right? So the clasp assembly, the clasp should encircle the tooth by more than 180 degrees, right? So this is called as principle of encirclement. I mean, if my way of representation is not clear for you, we have an image here. I'll just show you the image, right? I think it's clear, right? So we're talking about this image, right? So as you can see, the black one is the clasp assembly, right? So this clasp assembly, like, it's encircling the tooth by more than 180 degrees. So assume this as 0, 90, 180, right? So more than 180, you see this encirclement, right? So this is called, I hope it's clear, right? Is it clear? Right. Okay. So this is called as the first basic principle of encirclement, which is key for stability of the clasp assembly as well as for the stability of the tooth. When I say clasp assembly, it means even the processes, even the removable processes, right? Now, the engagement can be in form of a continuous contact, such as in case of circumferential clasp, or discontinuous contact, as in case of a bar clasp, right? So in circumferential clasp, we find this kind of continuous attachment, whereas in bar clasp, we find discontinuous or incomplete attachment, right? So both provide tooth contact in at least 3 areas encircling the tooth. So tripod effect: the occlusal rest area, the retentive clasp terminal area, and the reciprocal clasp terminal area. So in the principle of encirclement, we need to have at least 3-point contact. 1 point at the occlusal rest area on the occlusion, right? So if this is a tooth, on the occlusion you need to have one particular area of contact. The other is the retentive clasp terminal area, and the third one is reciprocal clasp terminal area. So these are the components of a clasp assembly, right? So occlusal rest area, retentive arm, and a reciprocal arm, right? So I'll just show you in the image once again. So this will be your occlusal rest area. Is it clear? Occlusal rest area. So this will be, for example, your retentive arm. This lingual will be your reciprocal arm, right? Yeah. So in the basic principles of clasp design, the first basic principle is principle of encirclement, right? Now, in addition to encirclement, other basic principles of clasp design are as follows. The occlusal rest must be designed to prevent the movement of clasp arms towards the cervical. So as I have shown you, the occlusal rest, the dotted area in the marginal ridge area, that has to be designed in such a way that it prevents the gingival or cervical displacement of the entire clasp assembly, right? So the occlusal rest must be designed to prevent the movement of clasp arms towards the cervical. That's an additional principle, basic principle of clasp design. And next, each retentive terminal should be opposed by a reciprocal component, which is capable of resisting any transient pressures exerted by the retentive arm during placement and removal. So when you remove a process and place it, you need to have a retentive arm and a reciprocal arm. When retentive arm, it creates some kind of forces. Those forces should be balanced by this reciprocal arm, which aids in stability as well as retention. So each retentive terminal, whether it can be retentive arm or reciprocal arm, should be opposed by a reciprocal component capable of resisting transient pressures, because when you remove and place a processes, the forces acting on the clasp when they're coming in contact with the abutment tooth, they're very transient, right? Only momentary. They do not last for longer duration. So this reciprocal component should be capable of resisting any transient pressures exerted by the retentive arm during placement and removal of processes. Stabilizing and reciprocal components must be rigidly connected bilaterally to realize reciprocation of retentive elements. So what all we discussed now, this is possible only when the retentive and the reciprocal arm are connected in a very rigid manner. Cross arch stabilization. I mean, they're saying cross arch in the sense because it's crossing the midline of the tooth, right? So cross arch stabilization has to be there efficiently in order to allow this reciprocation and retention to happen, right? So that's another basic principle. So as you can see here, the same image, the same point is described in this image, which you can see here, right? So in this top diagram, if you can see, so this, look at the look at my pointer, the finger where I'm pointing towards. So this is the buccal side. Here we have a retentive arm, right? And this is the lingual side, right? So this is the buccal side, this is the lingual side. So buccal side we have a retentive arm, lingual side we have a reciprocal arm, right? So as you can see, so look at the top image first. So on the buccal side, right, on the buccal side, because of the action of retentive arm, forces are being directed medially, right? As you can see here, the arrow marks, forces are being directed medially, right? So this medial force or medial component of force which is created should be balanced by the reciprocal arm which is present on the lingual side, which you can see in this image. So this is balanced by the reciprocal arm present on the lingual side. So that's what they have been given in this illustration, right? So the retentive component forces, the forces created by retentive components, transient forces during placement and removal of processes should be balanced by the reciprocal component, and this is possible when both are stabilized properly or when they are both are connected by rigid manner, right? So cross arch stabilization is very important. And then coming to the next basic principle, clasp retainers on abutment teeth adjacent to distal extension bases should be designed so that they'll avoid direct transmission of tipping and rotation forces to abutment, right? So whenever you have an edentulous area, I have made one video on Kennedy's classification Applegate's rules, right? If you have seen that video, adjacent to the edentulous area, if you have an abutment teeth, so what he is saying is you should design retainers carefully, or else what happens is in the edentulous area you're trying to cover more number of you will place artificial teeth, right? So the forces acting on these artificial teeth in the edentulous area can be transferred to the abutment tooth, and that can be damaging to the abutment tooth if you do not design your clasp properly, because clasp is the component of RPD which connects the removable partial denture to the abutment tooth, right? So the forces from the edentulous area should not be going and harming the abutment tooth, right? So keeping that in mind, we should design a clasp assembly properly in such a way that the forces should not be damaging to the abutment tooth. So while designing, just keep that in mind, right? So that's what the other basic principle says, right? I'll just go through it once again. Clasp retainers on abutment teeth adjacent to distal extension bases should be designed so that they will avoid direct transmission of tipping or rotational forces which can be harmful to the abutment teeth, right? Yeah. For this to happen, there has to be placement of stress breakers, right? So stress breaker, in effect, they must act as stress breaker either by their design or by their construction. This is accomplished through proper contact of retentive terminal relative to the rest, or by use of more flexible clasp arm in relation to the anticipated rotation of a denture under functional force. So you can either incorporate this stress breaking appliance either by designing clasp arm with such a material that it is more flexible, or by proper location of retentive terminal relative to the rest area. So by appropriate location of the retentive terminal with relation to the occlusal rest, or by designing with such a material which is flexible, we can create this stress breaking effect, which in turn prevents harmful rotating or tipping forces being acted on the abutment teeth, right? So that's pertaining to another basic principle in clasp design. Now, so we still have 4 more principles. We'll just go through them fast. Unless guiding planes will positively control the path of removal and stabilize abutments against rotation movements, retentive clasps should be bilaterally opposed. That is, buccal retention on one side of the arch should be opposed by the buccal retention on the other, or lingual on one side opposed by the lingual on the other, right? In class 2 situations, class 2 is nothing but unilateral edentulous area, posterior edentulous area, right? In class 2 situations, the third abutment may have either buccal or lingual retention, right? In class 3, retention may be either bilaterally or diametrically opposed, right? So they're given different Kennedy's configurations here, class 2, class 3, right? And they are explaining the probable locations of these retainers, right? So as I discussed right previously, guide planes are nothing but parallel walls which allow easy path of placement as well as removal of processes. So unless guiding planes will positively control the path of removal and stabilize abutments against rotational movements, retentive clasps should be bilaterally opposed. The general basic principle is retentive arms should be bilaterally opposed, right? As I said, if they are present on buccal side, for example in Kennedy's class 1, if they are present on buccal side on one abutment tooth, it should be countered by the buccal retentive arm on the opposite side. If lingual, then lingual on the opposite side, right? So that will create a kind of stability, right? So in class 2 situation, the third abutment may have either buccal or lingual retention. So class 2 is nothing but unilateral posterior edentulous area, right? So in such situations, you can go for placement of a retentive arm on a third abutment, which and this position can be either buccal or lingual. So it's nothing but tripoding effect, right? So we'll discuss all the principles of RPD design later. We'll have more clarity over this, right? And then coming to the next basic principle, the path of escapement for each retentive clasp terminal must be other than parallel to the path of removal for the processes to require clasp engagement with the resistance to deformation, that is retention. So the path of escapement, we have something called as path of placement and path of escapement. So the path of escapement for each retentive clasp terminal must be different or other than parallel to the path of removal for the processes. If it is in line with the path of placement, then obviously there will be dislodgement, right? So the path of escapement for each retentive clasp terminal must be other than parallel to the path of removal for processes to require clasp engagement with resistance to deformation, that is retention. So to have proper retention, you should have path of removal which is other than parallel to the direction of path of placement to have added or extra retention, right? And then the next basic principle, the amount of retention should always be minimum necessary to resist reasonable dislodging forces. So the retention should always be minimum necessary. So how much retention, like if they ask you like how much retention we should have for a particular removable partial denture process, then it should be minimum to that of necessary to resist reasonable dislodging forces. If for example reasonable dislodging forces are X, then the amount of retention that's needed is X, right? So that's what they're trying to explain this particular point. And then coming to the final basic principle of this retention basic clasp design, reciprocal elements of clasp assembly should be located. This is very important, right? If possible, underline them and make a note of this. Reciprocal elements of clasp assembly should be located at junction of gingival and middle third of the crowns of abutment T. So the reciprocal element should be located at junction of gingival and middle third of the crown. So as you can see here, you have this gingival third, middle third, right? This is gingival third, this is middle third. So at their junction, we should have this reciprocal component of the arm. Reciprocal elements of clasp assembly should be located at the junction of gingival and middle thirds of crowns of abutment T. And then the terminal end of retentive arm, is optimally placed. Terminal in the sense it's the tip of the retentive arm. The tip or the terminal end of retentive arm is optimally placed in the gingival third of crown, that is in the undercut area. As we discussed previously, the terminal end has to be engaged gingival to the height of contour in the undercut area in the cervical region, right? These locations permit better resistance to horizontal and torquing forces because of reduction in the effort arm as described previously. So as I said, we have these principles of levers and fulcrums and also these efforts, right? So we will try to discuss that separately, right? So while designing a basic clasp, we need to keep this in mind, especially the location of the reciprocal elements, which has to be placed at the junction of middle third and gingival third, right? So we're trying to engage in the undercut area, and the terminal end of the retentive arm is optimally or ideally placed in the gingival third of the crown, where we can have better resistance. It's for retention, as you all know, but most importantly, we'll have better resistance to horizontal and torquing or rotation kind of movements, right? So these are the basic principles of clasp design. I know it's very challenging to understand this basic concept, right? So we need to have that passion, first of all, right? So passion to go through. See, once you refer these standard textbooks, right, so you'll have super clarity on subject, and once you have that clarity, you can answer any question, you can practice anything with a lot of confidence, right? So that's the reason why we are that's the idea behind this session, right? So I'll just show you the image here. So I mean, I don't think you can actually read this, right? So as you can see here, they mentioned here retentive area, stabilizing area. You can see here the dotted ones. Yeah, the dotted ones here. This one, the dotted ones, they're all retentive areas. I mean, we should design clasp placement in this area to have retention, and for sake of stabilization, we should place it somewhere here in these lines, right? So this is the junction of cervical to middle third, and this is below the height of contour in the gingival third area, right? So these are the locations for placement of reciprocal elements and as well as the terminal ends of retentive arms, right? Hope it's clear, right? So we'll just try to summarize. So before I summarize, I'll just go through the questions, if any, and then we'll conclude the session, right? Don't mind, I'll just have a 2-minute break. I'll just have something. In the meanwhile, you have any comments, just post them here, right? I mean, how is it going? Like, are you able to follow? Because your feedback is really very important. Like when I'm reading out, when I'm trying to explain you, are you able to follow out? I mean, are you able to follow what I'm trying to explain? I mean, the images which I'm showing, I mean, are they clear for you when I'm showing them? Or, I mean, just let me know how it's going. Bernice says, I didn't understand fifth principle. Okay, Bernice, we'll just summarize all the principles once again in brief, and I'll try to clarify them once again, right? All the principles, including the fifth one. Shreya, reciprocal end on junction of gingival and middle third. Terminal ends, and what about retentive arm? Shreya, we're talking about reciprocal end, as you said, junction of gingival to middle third, right? For reciprocation. Terminal end of what? Terminal end of retentive arm. We're talking about the terminal end of retentive arm, which has to be engaged in the gingival third area, in the undercut area. In the undercut area, right? I mean, really, how many of you have hard copies of McCracken? Please let me know. I just wanted to know, like, how many of you really have a hard copy of McCracken? I mean, without hard copy, it will be like seeing something somewhere, and you'll have no clarity whatsoever. Okay, fine. Pooja, hi Pooja. You don't have? Okay, fine. I mean, you don't have that book, McCracken, or at least do you have a soft copy of it? I see. Okay, I will do one thing then. At least from the next time, what we do is, like, I mean, if I can take the pictures and if I can share with you, I mean, can you get printouts of them, right? I mean, is it feasible? I mean, if you don't have a hard copy, like it's difficult to get standard textbook when you're especially out of college, right? So maybe from next time what we do is alongside when I announce a topic for you, I'll just take the pics of the matter and I'll share with you. I mean, I don't know whether it's I don't think it's acceptable legally. I'll just share some pics. Maybe you can take printouts of them and then you can follow it. All right, so the reason why I'm insisting on hard copies is because if you have a hard copy, if you have a physical copy, then you can really underline, you can really write down something, and it will be easy for you to register that in your mind. Ramesh, you say you have a soft copy, right? So soft copy, that's the issue we have. I mean, it will be difficult for you to physically get involved with your notes or book. Okay, McCracken is available online for reading. For reading. Okay, in that case, maybe you can download it, at least a soft copy. Yeah. Jagadish, you have it. Okay, fine. Yeah. Okay. Right, so I'll just briefly summarize all that we discussed so far. Especially we'll just briefly summarize the terminologies as well as the basic principles, right? Very quick, real quick, less than 5 minutes or 10 minutes if possible. So as I said, support is nothing but the foundation on which a denture base rests, right? So that is support. And stability is nothing but a quality of a process to be firm, stable or constant, and to resist displacement by functional or horizontal or rotational stresses. That is stability. Stability against functional, horizontal or rotational stresses. And then you have this retention, which is resistance to vertical forces of dislodgement. Example, forces of gravity, adhesiveness of food, or forces associated with opening of jaws, right? And then guiding planes, there are two or more vertically parallel surfaces of abutment teeth which are shaped to direct a processes during placement removal. They guide a processes for placement or either for removal. These are two parallel surfaces and these are called as guiding planes. And then we have a retainer. Retainer is something which helps in retaining, right? As simple as that. Examples, clasp, attachment device which helps in fixation, stabilization, retention. So that's a retainer. Direct retainer is that component which helps in directly retaining the processes and preventing its dislodgement, right? And example, a clasp assembly, right? So clasp assembly, we have this occlusal rest, retain to element, retain to arm, and a reciprocal arm, right? Yeah. And we have these types of clasp: bar clasp, circumferential clasp, right? We're not going into the clasp as of now. And also we discussed about indirect retainers. Indirect retainer is something which helps the direct retainer and helps in preventing displacement of distal extension denture bases by resisting the lever action from the opposite side of the fulcrum line, right? So see, the pen is moving this side, so this movement can be prevented by having a third attachment in this area, right? So this we're talking about indirect retention, right? And then we have these basic principles of clasp design. So the first basic principle is, clasp assembly, you know the components now, right? So the first basic principle is principle of encirclement, where the clasp or the arm should encircle the tooth by more than 180 degrees as shown in the illustration clearly. And along with that, we should have, like for example, in principle of encirclement, there has to be at least 3-point contact, right? Tripod effect, occlusal rest area, retain to arm, and reciprocal arm, right? In addition, we have other basic principles like the occlusal rest must be designed so that it prevents gingival or cervical displacement of this clasp assembly. And each retentive arm should be opposed by a reciprocal arm which is capable of resisting any transient pressures, right? To have that balance and stability, we need to have a retentive arm and a reciprocal arm which are joined by a rigid connection, cross arch stabilization. And then we have another principle like clasp retainers on abutment teeth adjacent to distal extension bases should be designed in such a way that the forces from the distal extension base or from the artificial teeth should not be damaging to the abutment teeth. Hence, we have to incorporate stress breakers either by appropriate positioning of retainer or by preparing that retainer with a kind of material that is more flexible, right? So that's another principle. And talking about the location of these, someone said like they didn't really get this point, right? So what they're trying to explain in the next principle is, right, so while designing an RPD, while designing a clasp assembly, we should have this tripoding effect, right? So for example, if it is a class 1 bilateral distal partial edentulous areas, then if you have a direct retainer on one side, we should have an opposing direct retainer on the opposite side. For example, if you have a retainer on the buccal side in relation to 4-6 area, then 4-6 abutment, then you should have another direct retainer in 3-6 area, right? So you should have corresponding retain to arms which are placed to balance the forces acting, or else there can be tipping or lifting of denture bases, right? Retain to clasps should be bilaterally opposed. So that's the principle. So Bernice, right? So Bernice said like she finds it difficult to understand. I think this is the point, right? So retain to clasps should be bilaterally opposed for greater stability. So that's the fifth principle, right? And then you have this path of escapement. So the path of escapement or removal of processes should be other than parallel or should be different from the path of placement of processes, right? Path of escapement for each retain to clasp terminal must be other than parallel to path of removal, right? So that's obviously understood. And the amount of retention should be minimum to the amount of force that is required for dislodgement. Like how much amount of retention has to be there for a clasp assembly? That should be minimum necessary to resist reasonable dislodging forces. So that's just to give us an idea and to have an understanding that retention depends upon the amount of dislodging forces that are acting. If the dislodging forces are 10 units, for example, you should have a minimum retention of 10 units, right? So they're trying to convey that point there. And because how do you evaluate that clinically? Maybe I feel like, for example, if you have bruxism, if you have like various other parafunctional habits or even different occlusal arrangements, then in such cases we'll try to consider these principles while designing a clasp assembly, right? Clasp design. And then finally, reciprocal elements of clasp assembly should be located at the junction of gingival and middle thirds of the crown of abutment teeth, whereas the retain to arms, the terminal ends of retain to arms should be engaged in the gingival third or in the cervical undercut area, gingival to the height of contour, right? So these are the basic principles in clasp design. It's very easy. See, you need not really memorize all the points also. You just try to understand them and try to have an overview regarding these points, and that would be more than sufficient, right? So you need not really by heart all these things, and because you're not going to write a theory, right? You need to just have an overview, and most importantly, you should have an understanding of these principles, like why we're trying to incorporate these basic principles, right? So anything else we missed? I'm just checking out. And Bernice, regarding the fifth point which is said, as I said, retain to clasp should be bilaterally opposed, right? And we need not have this bilateral opposition if at all we have properly designed guiding planes. That just keep in mind. If you have these guiding planes, then there would be obviously a better stability, and there will be better easy to remove and place, and there will be greater stability when you have these guiding planes, right? If at all guiding planes are not designed properly, or if at all it's not possible to incorporate them, then we need to have this bilateral opposition of retain to clasps, right? So this principle has to be incorporated in such situations, right? So that's the summary which I could get from that particular point. So anything else we missed out? And also they have explained, given us some important points regarding the placement of retentive arms in class 2 and class 3 scenario also. You can even have a multiple choice question in this. So what they're saying is, in class 2 situation, so unilateral posterior edentulous area, in class 2 situation, the third abutment may have either buccal or lingual retention, and in class 3 situations, retention may be either bilateral or diametrically opposed, as seen in figure 7.18. So that's what they're trying to show in this image also. I mean, if you can see in this image, so this is Kennedy's class 3 modification 2. We're calling it as class 3 because you have, see, posterior most edentulous area decides the classification, right? So this is the posterior most edentulous area. So we have teeth on either side of this edentulous area. So this is class 3. So these additional spaces, these are called as modification spaces, right? So this is class 3 modification 2, where you have retentive arms which are bilaterally opposed. You can see here alphabets. A, you have another corresponding alphabet here. So if you have a buccal retentive arm here, it should be bilaterally opposed with another buccal retentive arm. Or if you're planning for lingual, then you should have a lingual one simultaneously, right? So retentive clasps should be bilaterally opposed. This means using bilateral buccal or bilateral lingual undercuts as shown on this class 3 modification 2 arch, where the retention may be either bilaterally buccal or bilaterally lingual, right? So if you have guide planes, this criteria is not necessary as per this principle, but if at all guide planes, or as I said, if in case guide planes cannot be incorporated, then we need to have this bilateral retentive clasps. So retentive clasps which are bilaterally opposed, right? I mean, you have some clarity now. So, and also you just go through the images or diagrams given. I mean, it's very easy to understand once you just go through the diagrams, right? Diagrams or illustrations. Right? So these are the basic principles of clasp design. If you have any questions, you can shoot them. I'll be happy to clear. I'll be happy to know and to let you know, right? So this is a win-win situation. So I'll be learning in the process, and even I can teach you in the process, right? Because as I said, learning is a continuous phenomenon. It's not that once you complete your BDS, it's done. Or it's not that once, this message is for you all. It's not that if you complete your PG prep, you have mastered something. No, it isn't like that, because science is continually advancing and we need to update ourselves in a constant manner, right? So it's not that we cease to learn at a particular age, right? So there's nothing like that. So learning is a continuous process, and we should always be humble when learning. Only then you can really understand the concept, right? If at all we don't know something, or what's wrong in learning from others, right? Then trying to correct your concept and then go teach to few more, right? You just go through this, explain to your friends, master the topic, right? So it all depends, right? If you're really passionate and if you're really interested, if you want to really update yourself with this kind of information, then it will be amazing. It really transforms you to a better dentist, right? So it's not just merely by hearting things. It's not just merely writing down and getting highest marks possible in university theory. It's about understanding the concept, applying the concept for the sake or for the benefit of patient, and then analyzing in such a way that what kind of improvements can be further made in order to improve the overall quality of the treatment which you are giving to the patient, right? So that's the ultimate purpose. So keeping that idea in mind, so that's the ultimate thing, right? So keeping that in mind, if you start learning, then learning would be fun, be enjoyable, and it gives you a lot of confidence, right? So just keep this in mind. And so this I'll conclude this session. And right, so hope this is useful for you, and we'll try to replicate the same every week, every Wednesday, 7:30 to 8:30 p.m. right? 7:30, 7:35, 7:40, right? So mostly from 7:30 to 8:30, 1 hour session. We'll try to have this kind of textbook reference or textbook kind of discussion, and hope it will be useful for you, right? So the main objective of starting this kind of live session is to incorporate this habit or inculcate this habit of referring physically a standard textbook, and then underlining things, learning from it, which in turn gives you confidence, as I said, and it gives you, most importantly, authentic information. You Google it, you'll find a lot of information, you'll find lot many presentations, lot many images, but what all you find in a standard textbook reference, the information is authentic. We have, at the end of every textbook, every chapter, you have something called as references, if you had ever observed. So these references are all standard and in the available literature, and these textbooks are prepared keeping in mind these references, right? So that's why we say refer these standard textbooks. And I was reminded of one incident. So I keep on saying this, but again I feel that it's a appropriate time to discuss with you all. So when I made my first video last year, 2016 January, when I presented my first video regarding tips for PG prep, it's available on YouTube. After presenting that video, in the comments below in Facebook, one of my Facebook friends, Ajar Ali, as I mentioned previously, he was AIMS topper, AIMS first rank. So what he said is, Naveen, it's good job, but what you do is, along with the tips which I mentioned, also inform to your students that referring a standard textbook by themselves, right, that makes a huge difference. You should take the pain of referring a standard textbook, opening a standard textbook, studying standard textbook, and if necessary, referring a standard textbook while you're solving MCQs, because it gives you authentic information. You'll never have any kind of confusion. Like one MCQ book says this is A is right, the other MCQ book says B is right. So you'll not have this kind of confusion if you follow standard textbooks. I know it's challenging, I know it's not easy, but if it were easy, everyone would do it. So what makes you special? What makes you special is the effort which you put in, and that comes with your interest. And that interest can be inculcated by understanding the overall idea of what we are exactly, what am I doing now? What are you doing now? Why are you doing PG? Why have I done my BDS or MDS? What is the ultimate aim? So that you keep in mind, you understand the concept that way, as I described previously, right? You're trying to improve the overall quality of our profession, right? So that's a wider perspective. So keeping that in mind, you start with basic, try to master these basics, and there is no second thought, right? You'll just master and you will be the perfect man possible, and you'll convert yourself, you'll see the better version of yourself, right? So it's time taking. So at least now, those who are preparing for this year's NEET, at least you make a habit of referring while you're doing MCQs. But those who have time, 1 year time, 1.5 year time, or 8 months time, or even 6 months time, make sure that you refer certain topics based on their importance in standard textbooks. And for all those who are graduates, like who are going through, who are in final year, second year, third year, you make it a habit to read a standard textbook, right? So I have given you enough reasons why you have to read a standard textbook, right? I will not bore you again with the same stuff, right? So I'll just conclude the session here. Do we have few comments? Yeah. I know my wife often complains, saying that I have this habit of repeating the same thing. Yes, that's true. I repeat certain things because okay, we're getting some sounds there. Sounds back there. I should be careful. So the reason why I keep on repeating certain things is not because I have some comprehension problem or some problem in my brain, but it's because that's important, right? So I'm trying to stress that. That's the reason why I keep on repeating certain things, right? If it's troubling you, apologies, right? Okay. So after live session, I'm going to get banged. Okay, fine. Shreya, please upload the soft copy of our WhatsApp group if possible. Okay, fine. Kirti, I was always confused about the placement of retentive and reciprocal arm, but it got clear today. Oh, glad to hear that. Good. So now what you do is again go through the textbook, just give a single reading, observe all the images given there, then just leave it. You just get the concept and leave it. Don't take the pain to remember all that now. Just get the concept. Just have an understanding, leave it. Once you revise second time, it will be there in your brain instantly, right? And glad to hear that, Kirti. Yeah, it's already uploaded in WhatsApp group, I think. Okay, Bernice, thank you, sir. It's clear now. Glad to hear that, Bernice. Swapnil, a really good session, sir. Thank you so much. You're welcome, Swapnil. Glad to hear that. Bernice says, a great initiative, so inspiring. Thumbs up, Bernice. And thumbs up for all of you for participating in this live session. Shreyash, like we have, the exact kind of thing which I wanted to see. I spoke for 1 hour, for 15 or 20 minutes regarding the importance of referring standard textbook, and Shreyash just gives that in a single comment. Referring standard textbook is time consuming and challenging, but if you once go through it, the subject is in your pocket. Thumbs up for you, Shreyash. Ajaj, sir, Pulse coded textbook lines. Won't it help? Of course it helps, Ajaj. Yes, it helps. But you have to refer standard textbook because there is no alternative or no shortcut other than referring standard textbook. Yes, in Pulse or in some other MCQ books, you will have some textbook lines given exactly the same. That's fine, right? That's also fine. But not all topics are covered in that manner, right? So for rest of the topics or for most of the topics, you need to have this kind of orientation. If you have an exam in 2 months or 3 months time, then it's not that you should start studying your standard textbook now. It wouldn't be a good idea, right? So now only a reference if necessary, right? Based on the topic, right? Aparna, I want to join WhatsApp groups. Me too. Okay, I'll post the link here, the invitation link, so that you all can join. Where is the link? 1 second. Yeah, I'll just post the link. You can just click the link and I guess you will be added into the group simultaneously, right? 1 second. Sayari, it's nothing like that. It's not for academy. In fact, my students are angry with me saying that I'm not starting on WhatsApp group for them. But we'll start that soon. Just give me a second. I'm just trying to copy this link. Okay. Yeah, I posted the link. So you can just open that link. You have to open that link from your mobile, not from the laptop or other devices. Only from your mobile, you just click that link. You're welcome to our group, and this group, we're not going to have any kind of discussion. This group's purpose is only to share the updates. Only the updates pertaining to our academy, like any videos, any tests, or it can be like any live session updates. So all such updates will be done in our group, right? I'll share the purpose of group and instructions or guidelines once again once you join the group, right? Group discussion, as of now we're not planning it, Shreyash. We'll definitely go ahead with that kind of plan as soon as possible, but as of now it's only for updates, and I hope you can understand, right? You're all welcome. It's my pleasure. Yeah. So anything else you wanted to share, my dear people? And by the way, we have a morning session tomorrow, right? So I'll give you attendance. So you have to come by 5 a.m. right? So morning 5 a.m. session, I feel really excited because it will be the first time I'll be live. I mean, obviously, 5 o'clock, a class, 5 o'clock is like when I was in +1 or +2, I used to go to tuitions and all. It used to be like hell. But now I think that was out of compulsion I had to attend, right? Out of compulsion, like I had to get highest marks, a state rank, national rank. That was not so enjoyable, but this I think it's different. I think it's different for me, at least, because I'm doing it out of passion, of interest, and out of your request, right? Because most of you in the previous live session just asked me for morning live sessions also, so I incorporated them at 5 a.m. So we'll see how it goes tomorrow. Bernice, how to give test? We have free demo tests. You can give free demo tests. You can just mail us. We'll give you access to free demo tests. And we also have a regular weekly test and cumulative revision test and also online lectures. You can just mail us for course details. We'll just mail you, right? So you have any queries, friends, you can mail us at proudtobedentist@gmail.com, right? It's past 65 minutes, approximately 1 hour. So just conclude the session, right? Hope you guys enjoyed it. So that's more important. We should enjoy, only then we can sustain that activity, right? If you feel that as pressure, it gets cut. Let's just keep that in mind. So glad you all joined me live. Keep smiling, and we'll see you tomorrow morning with more and more multiple choice questions and more discussions, right? Mikita, very good evening. By the way, we are about to leave, Mikita. I think you joined just now. Of course, it's thrilling and exciting tomorrow, Ketu. We'll see. Yeah. Yes. So thumbs up, all of you. So good night. Take care. Keep smiling. Rock on, right? Have a nice day. Bye. Good night. And see you tomorrow morning at 5 a.m. or 5 a.m. sharp, right? Bye. Take care.